Another huge complaint that we get is witness apneic episodes. What is that? That just means a cessation in breathing. So someone can tell you that you stopped breathing while you were sleeping. That's also huge. Another one we get is problems with memory and concentration. We can also see mood problems. Let's talk about the causes of central sleep apnea. There are 6 main causes that I listed. First one is medical problems. There are some medical problems that put one at risk of central sleep apnea, and I'm going to list them. Congestive heart failure is one of them. Basically, any type of heart failure can lead to central sleep apnea events. Atrial fibrillation is also another big one. Chronic kidney diseases and neurological problems such as a stroke or a tumor in the brain can lead to central sleep apnea. The number 2 cause of central sleep apnea that I have listed today is high altitude. Now, when you travel to places that are considered as a high altitude location, you could experience these symptoms that I listed earlier because you are at risk of central sleep apnea. And that might be temporary, right? When you get off that location, things might get better. And so if you're moving to such a place, right? If you're not just going on a vacation, you're relocating to such a place and you're experiencing those kind of symptoms, then you really want to make sure you check out and see if you might be having central sleep apnea events. Number 3, medications. One main medication that I want to mention is opioids. A lot of people are on opioids for good reasons, right? Mostly for pain, knee pain, back pain, all kinds of pain, shoulder pain, and even for treatment of restless legs, the severe cases of that. But we have found that opioids can put people at risk of central sleep apnea. Next item is some kind of breathing that we call Cheyne-Stokes breathing. And this is typically seen in people that have medical problems that I listed earlier, like heart failure, atrial fibrillation, or a recent stroke. The last reason, or the second to the last actually, is idiopathic. Just another way of saying we don't know the cause of it. It just came from nowhere, essentially. And the last but not the least is treatment of sleep apnea with a PAP machine can actually lead to central sleep apnea events. And that's the type of central sleep apnea that we call treatment-emergent central sleep apnea. All right.